Hello, everyone. This is Tejaswini Papineni, and my project is reducing wait times in healthcare using Monte Carlo simulation. Um, Basically, I have chosen this topic because I kind of felt interested when I have gone through many topics for this project, and this mostly follows queuing theory. So, little bit background on this. So, whenever a patient's visit either emergency care or urgent care, most of the times we do wait for the operating rooms. It's not an easy to get like an operating room or surgery done. At that point, there will be some kind of waiting time. So the idea over here is to minimize that wait time by identifying the ideal number of operating rooms that needs to be available. Um, yeah, considering the day and night time operating rooms available and a lot of factors. So that is the main idea. And coming to the summary, um, I will be using Monte Carlo simulation method for this. And the assumptions that were made for this were at this point, the assumptions that were made were neglecting the wait time, like when the patient enters and when the physician arrives, that little time will be neglected here. And as of now, I am assuming there will be only 5 physicians available. um, and uh, and the status report, this report is actually what I have done till now. I've started writing program using Python, and the parameters that I have considered as of now were number of operating rooms required in daytime, because as this is the ideal way of identifying the operating rooms that were required. So I need to consider the operating rooms that were used and utilized during the daytime and also during the nighttime. That way I can identify the ideal operating rooms required. And the minimum class of patients that enter only during daytime, because there are certain classes that prefer to enter during the daytime. When I say class, it is elective, non-elective. That means so the patients that need the surgery, non-surgery, and there are a lot of factors here. And when it comes to the hours, like here, the next factor I'm considering is the number of hours in a day where only night operating rooms were used, like the um, bookings were done actually in the whole day, and only the night operating rooms were used. So that's whole count of operating rooms during night time only on that day. And the cleaning time, because for every surgery or anything is done, I think there will be a cleaning time that needs to be considered, um, because that also factors the wait time. So that's one of the parameters I'm considering. And so far, the pieces I have implemented in the code were like to check how many patients, because this is a minute to minute, it runs for every minute. So to check how many patients were arrived, like for every minute. And I mean, like I use the concept of Poisson distribution here. And whoever the patients that were arrived, I'm adding that to the queue, the patient's queue. And the next step is to check if the operatings are available or not at that minute. If not, like as it is a loop, it checks for every minute if the rooms were available or not, and all that steps. There are lots of next steps that needs to be written. I'm still working on it. Um, and for testing this, actually I'm using the data from UC Davis Medical Center. Basically, I got this data from one of the research papers I have been going through for all regarding this healthcare models and all. So I'm using that data as of now. So that's the summary, and that's the status of my project. And thank you.